How you doing? At the end of today's video, you're going to learn how to self-assess and do a quick check at home for your range of motion in your ankle. Because this simple thing, ankle range of motion, can affect a lot of things up the chain. It can affect your ability to squat, it can affect your ability to jump. Even in extreme examples, a normal gait, how you walk, it'll throw off things. It's kind of like your foundation point, and everything up above that, which is everything, basically is affected by a loss of motion there. Now in certain cases, this can be from a post-surgical case, it can be from an old injury, maybe an ankle sprain. You also may be doing certain sports that you can develop muscle imbalances for. So that's something that we really want to address as soon as possible so you can move better and more efficiently. So what do we need as far as ankle range of motion? Which direction are we going to talk about? The most common direction that you see loss of motion most times, especially after injury, like we said, injury, post-surgical fractures, things like that, is ankle dorsiflexion. So what does that mean? So dorsiflexion is simply when the foot moves in this direction like that, whether it's planted on the ground or you're walking over it or squatting, okay, or in the air, it doesn't matter, but it's all dorsiflexion. You need between, this is 0, you need between 10 and 20 degrees. Okay, whether it be on the floor or up in the air, it's the same, the same amount of motion. Now for athletes, you need a good 20 to 30 degrees of that motion. So you need a lot of dorsiflexion for a lot of different movements, jumping, anything that requires, excessive motion, sometimes really deep squats. You need that excellent motion so you don't have compensatory problems sometimes up the chain where it affects the quality of the motion. Even if it's not painful, you may not be as efficient as you can be without this. So the self-test is really important to kind of see that, where can I improve? Is this something that maybe is affecting my squatting or something that I'm doing, even like hiking or something that you enjoy doing, you just don't feel as comfortable doing? Maybe it's related to the loss of motion. And this is something that you can definitely affect and to a degree, depending on the situation. Sometimes you can make tremendous improvements in this with just focusing on this area. And it's a common area that can get tight. So we're going to talk about the self-test next. Stop for a second. Is that on?
Okay, you're good.
Okay, so we're going to go over our self-test. It's very easy. You can do it at home. Make sure your shoes are off. What we want to do is get our foot on the ground. And we want to ride our knee forward like this. And we want to go as far as we can. If we're getting to the wall and we still feel like we can go further, we want to slide out a little bit and then go forward again. So for me, right about here, I'm right about to the wall. You can see like my heel is just about to come up, okay? And then that's basically going to be my measurement, my distance from my toe to the wall we're going to measure. Now what we're looking for, our goal is to be at least 5 inches from the wall, okay? And you test both sides. As soon as the heel comes up, like, oh, that's considered, we have to move that a little bit further forward if that's the case. But you should kind of slowly inch back to the point where you just barely touch the wall. That's your measurement, okay? This is my better side. I know a little bit more flexible on this side. I'm probably looking at, 4.5, 5 inches right here because I've measured it before. And then we're going to check the other side, all right? But our goal is supposed to be to get to that 5-inch mark. And I would say for athletes, we probably want to be a little bit further even from the wall to get that measurement. Now, obviously in the body, we have left to right differences. So we want to be within 10%. But for the sake of this test, we want to be at least 5 inches, depending on what we want to do. But that's our goal. All right, so we take that measurement, toe to there, and then we're going to check the other side. And you can see on me what the difference is. You can see, as I move this one forward, how far I can go, foot here, heel on the ground, prior to hitting the wall. So I can slide back a little bit further, come forward. Good, I'm just about there, like I'm just starting to feel that. Feeling the stretch in this lower area in the front here. Just about touching there. Okay, so that's our self-test. You want to compare side to side. And in a couple weeks, 2 or 3 weeks, you want to do the next 3 stretches 3 times for 30 seconds. 2 or 3 weeks, you may notice a difference in that test. Maybe get a gain of 1/4 or 1/2 inch and shooting for that goal of 5 inches. Okay, so the 3 stretches I want you to do. The first one is just a simple standing stretch. The stretch leg, the forward leg is slightly bent. You want the knee straight. And you essentially want to come forward and hold that stretch for 30 seconds. You want to feel this in the upper area here. You can feel it in the lower area. You may feel around here, but just generally in the back, not just in the front of the ankle. You're going to come forward, you can hold it for 30 seconds, and then release the stretch. 3 times for 30 here. Second stretch. Bend your knee. Same idea. You keep this knee in a fix about 30 degrees, and you're going to bend. This one you typically feel a little bit lower in the calf region, what they call the soleus region. This is more the gastrocnemius. And you may feel it around the ankle. Toes pointing forward. As soon as the heel comes up, you want to stop. That's why it's good to do this without the shoes on. Forward like that. After 30 seconds, release it. Our last stretch you can do, you can just kneel. Essentially lean forward like that. You can even take a dumbbell or a plate and hold it over the side that you're stretching to say enhance the stretch a little bit. Kind of hold it in your hands or rest it on your knee. Get to that stretch position and let that body weight stretch into that point. This is a pretty intense stretch, okay? And you can see, the position I'm in. It's similar to doing like a squat. Like if I'm doing a squat, look at the motion I need when I drop in. I need that motion. You can see I'm coming up. Some people compensate by really turning their feet out to compensate for the fact that they have loss of motion. In fact, when people, after surgery or whatever, they'll actually turn out. You'll see they'll turn out because it doesn't require as much of the dorsiflexion or motion in this direction. So the way to do it is they kind of toe out to get around that. So we want to have that motion for whether it be a lunge position or squat. So let's work on that. All right? Good luck. Tell me how you do. And we have a little bonus right after this. Okay, occasionally we showed you those 3 stretches, and you may find that, wow, I'm just not getting a good stretch where I want it. Like you're not feeling a stretch with the other stretches I just showed you in the calf and this area. In fact, what you're feeling is called something called a talar impingement, okay? This is just the lower ankle. This is the tibia, this is the fibula, this is the talus right here, okay? So what will happen is actually in a case of talar impingement, and I've seen it a few times in a clinic, you may notice with gymnasts, dancers, or post-surgical fracture cases, or cases that people have actually fractured the talus or tibia, fibula, or all of them, as they get an impingement. So when the bone, essentially, when you go into a position, especially when you're in weight bearing, the tibia comes forward and it catches. I'm going to show this from a side view here. So it actually catches this bone and it hinges. It can't quite get around that. So what we want to do is get some movement and it'll clear. Okay, so here it pinches there and you can't get it. And people will describe, they'll say in the front of my ankle here, a catch, like I only feel the stretch in the front. Most likely you're not stretching the right structures. You may feel some pressure in the front, but if you feel just in the front and nothing up in the calf, most likely you may be developing something like that, and it's not going to be an effective stretch. It may in fact irritate you a little bit, so you want to be careful about working through that stretch, okay? So you feel it there, but we have a couple options that you can do. In the office here, we'll do some stretches where we actually try and mobilize this ankle bone and just help you feel that position and loosen up that position so you actually get the clearance of the bone. Okay, it's good to identify. You'll see it sometimes very early on. People are starting out, they're only about 0 degrees. They could barely get past neutral here. But I'm going to show you a self stretch you can do on your own. You want it, like I said, you want this pretty low, so the direction is coming down. You're going to get yourself on here, and you want to try and get it a little bit below. You can see right here, this is depicting the talus bone, this is the tibia, okay? Just to go over. So we have it here, talus, tibia. We're trying to get a little pressure across the front here so you can kind of slide forward, okay? So you want a fair amount of tension. You want a lot of tension through here, okay? Okay, and you're going to essentially, once you get that tension through, you want to do it when you're more vertical. And then you're going to slide forward and press down. Okay? All right. And just come forward and make sure your heel isn't coming up. Good pressure and back down. And it's supposed to help and facilitate that glide backwards. Get you a little cueing, and hopefully, if you have it too high, it's actually going to make probably the stretch harder to do. Okay? So just keep that in mind. Good thick strap. If you don't feel like they have enough load, come out a little bit further so you feel good pressure in that area. And it should make it feel better. It shouldn't make it feel worse. Okay? Hope you feel better, and hopefully you get more of a calf stretch from doing that over time. Sometimes it's hard to self-correct. You really need some help and someone to get in there, like a therapist, and just stretch it out a little bit, and then that'll help you do it at home. I hope this helps you out a lot. If you like this, video, please, if you're not subscribed, subscribe. Turn on your notifications too so you know our next video that's coming up. Like it or share, right? Have a great day, and let's hear it. Are you moving better?